Welcome to
Hello.
week 452 of coronavirus quarantine, right? Something like that.
Yeah, it feels like it's been about 2 years since we started.
What does the outside even look like? We feel like this is the only way that we can see the outside through the window. Anyways, we wanted to share with you guys that we're still doing antibody testing. We are kind of running an antibody clinic in the office here. So rather than a video visit, which we are still doing, you can come into the office, have a chat with a provider, and do antibody testing in the office.
Right.
We welcome all people that are symptom-free, asymptomatic, and have had some kind of exposure or illness at least 3 to 4 weeks ago.
Right.
So if you were sick 2 weeks ago,
Please don't come in.
No.
And don't kind of say, well,
But then I was exposed to somebody.
Yeah.
No.
We don't want anyone sick. This is to look and see if you had the virus in the past. So it takes your body, 3 or 4 weeks to at least to develop these antibodies. So if you were sick a couple weeks ago and you came into the test, it's not going to be relevant. So you do need to wait to see if you have them.
Yeah, good point. So along with antibody testing, we're also offering serology testing. Can you tell us a little bit about what is serology testing?
So serology simply is a blood test. So the finger stick test uses 2 drops of blood. The serology test is a blood draw. And with a serology test, the chance of having any false negative or false positive results is a lot less. The test that we're using has a sensitivity of 99.4%. So if you test positive for antibodies on that test, then we feel pretty confident that you had that exposure. Whereas the finger stick test, there can be some false negatives and false positives.
And remind us again, what is a false negative or a false positive? What does that mean?
Well, so if you got COVID-19 and you tested positive in the past, and then you did an antibody test and it came back negative, we would be worried that that could be a false negative because we would expect that you would have antibodies at that point. And then the flip side is if you're otherwise healthy, you haven't been sick, and you come in and you have some antibodies on your finger stick test, what we don't want is for you to assume that you're good, that you may have some immunity and you already had this infection. The serology test is basically confirming whether you really did have that exposure.
So a little bit more foolproof.
Yep. And as far as I know, we're the only clinic in the area that is actually looking and taking that extra step to try to verify. There's a lot of variation among the finger stick tests. And
right, there's not just one test, there are different companies that are offering antibody testing. So some people ask, why are we doing both? But many offices are not doing the blood draw, and maybe the future would be in the blood draw alone. But for now, we're doing antibody tests, and just to be safe, we'll also draw your blood if you had a likely story, but the test comes out kind of weird and not the result that we're expecting.
Right. Yeah, we basically we as a clinic want to gain more information from testing everyone, but we also want to make sure that we're giving patients the most reliable results that we can at this moment in time. I mean, as you know, things have changed almost every day with COVID-19. So we want to try to get as reliable of data as we can at this point.
So remember, antibody testing is a test that you would do 3 to 4 weeks after you've been exposed or sick. So if you were sick in January, February, March, great thing to do would be antibody testing. Now, if you were exposed to somebody 2 weeks ago and you're wondering, gosh, I wonder if I had it. I haven't been at work for 2 weeks. Maybe I should come in and get a test. What do you think about that?
Yeah, the antibody tests are not meant to be used in a clinical way. So they're not meant to be used to say you're safe to go to work or you can't go to work. It's still the nasal swab that is the test of choice. So if you had an exposure and you're worried that you're going to infect somebody, you really need to do the nasal swab. The antibody test, we've heard that there's some businesses that are saying we need to see that antibody test for you to go back to work. And the reality is that's not the way we use that test, and it should
Right.
not be used that way.
So even if you're not symptomatic, but maybe you had a lot of exposure to somebody who was positive and you're really wondering, am I possibly a carrier of coronavirus? You can always come in and get a nasal swab. And if it comes back negative and you didn't have any symptoms, then there you go. It was negative.
Right.
Maybe it will come back positive even though you didn't have any symptoms, but that would be the extra step to take.
Right.
A lot of people are hoping that they test positive in terms of antibody testing, which is fair. You test positive for IgM, meaning that you had the virus a long time ago.
IgG.
IgG, sorry. And IgM negative, meaning that you didn't
Yes.
have a recent infection or you're not currently infected. So IgG only would be ideal.
Ideal. That's the grand prize result.
Right.
That's what everyone's hoping for. That's what we're hoping for
Right.
when we're looking at those tests.
Right. So does that mean if it's IgG positive, I can go back out into the world like I'm good, I'm safe from the coronavirus, I can do whatever I want? Can I get it twice? Can I not?
We wish that were the case, and we hope that ends up being the case. But right now, because it's so early still in the pandemic, we don't know if those antibodies mean that you're immune long term. We think that that's probably the case. The World Health Organization, Dr. Fauci, they've all said that there probably is going to be a period of immunity. We don't know what that is. So with IgG, maybe you have a little bit of peace of mind that, I had this exposure, and I probably am not going to get as sick if I get exposed again. But you still have to take all the usual precautions, washing your hands really well, wearing a mask when you're out in public. It's not a free ticket to go back to life as normal right now.
You don't get a ticket to ride. Cue song.
She's got a ticket to ride. She's got a ticket to ride.
All right, well, I guess that's it for us this week. Hopefully next week, maybe we'll talk about something not coronavirus related.
That'd be nice. Send us your questions.
But yes, any questions and answers, we'd like to do a Q&A, definitely about coronavirus, but about other things too. So
Any medical
any and all
issues.
topics, we are here for you.
We'll just,
That's